Less than 150,000 people in the U.S. suffer from IgA nephropathy. It's a rare chronic autoimmune disease that affects the kidneys. Now, the rarity of this disease leaves patients and their families feeling isolated and unsupported. Now, here to talk about the resources that can help us and treat it is Andrew Udell, North American President at Calliditas, and Judy Aikman. Yes, she's an IgA nephropathy patient and advocate. So thank you both for joining us. I know that's a lot at home. You're saying, okay, let's learn more about this IgA nephropathy. So Andrew, what are its early symptoms? What is it exactly?
Sure. So IgAN, or IgA nephropathy, as you said, it's a rare progressive autoimmune disease. And what happens is the body attacks the kidneys, causing inflammation and damage of the kidneys. Even though it is a kidney disease, it is believed most often to begin from antibodies that are formed and produced in your gut, actually. As far as symptoms initially, patients, it varies. Each patient's journey is different. And some patients will feel or see things like blood in the urine or frothy urine, or feel flank pain, low back pain, or get inflammation in the legs. Others won't have as much symptoms before diagnosis.
Okay, thank you so much. Now, Judy, thanks for being with us and sharing your story. You were diagnosed with this in 2019. Tell us a little bit about your experience with the disease and how you manage it.
So yes, my journey started in the summer of 2019 when I went to a primary care doctor, routine visit, and she was concerned about my blood pressure. So she decided to run some blood tests, and it came back that I was in stage 3 chronic kidney disease, which led us to a biopsy, which was determined that I had IgA nephropathy. Now, when I was diagnosed, my doctor sent me on my way with some treatments for the symptoms and basically kind of just left me to navigate the illness, which was really isolating, really lonely. And not only that, but it was also really affecting my family. So my son, who at the time was 5 years old, he had such a hard time with it because he had to start, realizing that his mom may not be here someday. So, to put off the dialysis, I went on a low-sodium plant-based diet. I started seeing my doctor every 3 months to make sure my kidney function and my protein levels were really good, stayed in the baseline of where I needed to be. But it was really hard. I lost my career because of my disease, and I was in a very hard place. So I turned to social media so that I could reach out to other IgA nephropathy patients and connect with them for more support.
Well, Judy, you look wonderful, and it's so nice you did have some of that support you needed, and spreading the word to others that, yes, there is some help out there. So let's get back to Andrew. What are some of the treatment options currently available?
Sure. Obviously, patients should seek consultation and speak with their physician, but to date, in the past, really most treatments were around supportive care, lifestyle changes like diet, like Judy explained, and things to treat some of the symptoms. Fortunately, over the last few years, there's been a lot of research, and Calliditas Therapeutics, we've gotten the first FDA-approved medication that was specifically designed to treat this disease in its origin. And so very excited about that. But in addition, we're also excited about a portal we've developed called IgAN Connect. And IgAN Connect is really one central location that patients can go to find information on what to ask their doctor, learn about the disease, connect with other patients, to give them a support system like Judy was talking about.
All right, Andrew, Judy, thank you so much for sharing this with us. And of course, where can folks go for more information?
So they can go to IgANConnect.com.
Thank you. And of course, you can head to our website, and that would be firstcoastliving.net.